Many of you know Jim Becka as a Houston radio broadcaster, currently with KSBJ Radio, but he has also worked on area ambulances for almost 25 years. He recently spoke with other Harris County paramedics and EMTs about the acute shortage of trauma centers.
A major heart attack or automobile accident in the middle of the night can be especially frightening. But even more frightening is the possibility there may not be a hospital to care for your emergency. Most people stay focused on their job and they really don't think about what could happen on the way to the store. EMTs and paramedics know because they deal with medical emergencies on a daily basis. Like most people my age, when I was younger, I couldn't relate to illness or serious injury and wasn't concerned about our healthcare system. Much of the public is unaware that EMS providers throughout the day receive notices that many hospitals cannot accept their patients. This forces EMS crews to take patients to distant hospitals for care. An additional problem is that EMS crews sometimes are tied up in hospital emergency departments because hospital medical staff are not available to take over care of the arriving patient.
Drive-by is a problem for a 911 service, especially because it puts that truck out of service, and that whole district that truck serves is now without a truck. So if something happens in that district, it's going to take another ambulance longer to get there because they're not in the same area, and we'll have to wait an hour to 2 hours for a bed. And I remember one time I brought in a patient, and we sat there, and there was an empty bed right next to us. And I said, you know, why can't we have this bed? And they said, oh, well, we don't have enough nurses to staff this area, so if you put your patient in that bed, then there will be nobody can take care of that patient. So we had to put a 911 truck out of service for an hour because there wasn't enough staff to take care of patients.
Many times hospitals advise us that they're either on drive-by status or don't have beds. So we, if we do go to that hospital, we either have to wait in hallways for a long time or either divert to another facility. It's a problem now, and it's going to get worse in the future. It's bad for the patient and bad for everyone all the way around. The frustration pretty much all the time. It's a matter of you know, the nurses of the facilities, the crews and whatnot on the EMS units, and I think everyone feels the frustration, but I think this needs to be handled at a higher level through again, as I say, getting more hospitals citywide.
Out of the 5 or 6 hospitals I usually go to, 4 to 5 of them will be on drive-by at least twice in every 12-hour shift, at least. Some of them will go on more than that. They'll go further from normal drive-by to critical care drive-by, no beds, just as far as they can go. So they'll say they have no room, period.
During all the years that I've been involved in EMS, one of the most frustrating things happened to me one day when I could not find a hospital willing to accept a patient of mine that had stopped breathing in the back of my ambulance. First hospital told me that they just didn't have any emergency beds available. They asked me to take the patient to another hospital. So I called a second hospital. At that time, it really wasn't that big of a deal. We were equal distance from both facilities. The second hospital gave me a similar story. They said they didn't have enough staff. They also didn't have enough ICU beds, and they asked us to take this patient somewhere else. So I told the second hospital, we're just going to have to come to your facility. We're going to stabilize the patient in your emergency room. Then we'll be happy to hang around and take them somewhere else. But we just can't drive all over the city with a patient that's not breathing. I'm Jim Becka with a commentary over the need for trauma centers. Managing major trauma has got to become a higher priority in Texas. Patients won't survive a long ambulance trip to a trauma center. But let me backtrack a little bit back to the 1980s when 20% of all EMS people were choosing not to renew their certification. They found limited opportunities and many were just getting too old to work on ambulances. I talked to a hospital administrator about the possibility of hiring paramedics to work in emergency rooms and trauma centers. His feedback was that it would be a liability unless paramedics had a license, like nurses. So I traveled to the Texas EMS Advisory Council meeting in Austin with a letter drafted by a group of South Houston paramedics requesting licensure. Immediately, the meeting turned to licensure, and a committee was created. I felt pretty good until after the meeting when the medical director of the Dallas Fire Department came up to me and told me the licensing of paramedics in Texas would never happen. But 9 years later, it did. If you compared an RN and licensed paramedic entering the job force, you would find that in most cases, both a licensed paramedic and RN would have the same number of college hours. Both would have a license, but the paramedic would have additional significant specialized training in endotracheal intubation and other emergency medical procedures that would be useful for an emergency room or trauma center. Trauma centers are needed. And we need to look to new ways of filling the shortage of trained people to work in trauma centers. We need to look to paramedics.